And that if you look at Chris Dax's work from Harvard, he really did an incredible job of looking at all the Framingham data. And he found that, if you're overweight, and what is the cause? And he seemed to correlate a lot of different things. But one of the things that he really jumped on was this notion that your social networks actually were driving obesity, that you were more likely to be overweight, like by 170% more likely to be overweight than if you had friends that are overweight than if you had family members that were overweight. It was like, maybe that was like 40% increased risk of being obese. So it was really the social threads that connect us more than the genetic threads that determine our health outcomes. We call these diseases NCDs, non-communicable diseases, like heart disease, diabetes, hypertension, mentioned. These are not, they're highly communicable because you're basically as healthy as the closest 5 friends you have. And if all your friends are doing yoga and drinking green juices, you're going to probably be healthy. And if all your friends are drinking beer and eating hot dogs and sitting on the couch watching football, eating Doritos, which, people like to do that, that's fine. But I'm just saying you're probably not going to be as healthy. And so I think it really occurred to me that we need to create a model for addressing chronic diseases beyond just a one-on-one doctor-patient visit. And it's really a community solution. So long story short, Rick Warren, the pastor of Saddleback Church, came to see me as a patient. And I said, well, why don't we have dinner after? And we chatted. And I said, well, gee, I'm kind of a Jewish doctor from New York. I don't really know much about evangelical churches. Can you tell me about your church? He says, well, we got 30,000 members. I'm like, wow, that's a lot of people. That's a mega church. And then he said, well, we have actually 5,000 small groups that meet every week to support each other to live better lives. I'm like, oh, this isn't a mega church. This is thousands of mini churches. And then the light bulb moment went off in my head. I'm like, wow, Rick, why don't we actually use these groups to implement a healthy lifestyle program in the church? And he was like, great, because I realize I'm overweight and half my congregation or more is overweight and we need to do something about it. So let's do it. And so we basically created this plan called the Daniel Plan, after Daniel from the Bible, who resisted the king's temptation of rich food. And we didn't know how many people would show up. We just created a rally, basically an event where we had talks and got people inspired, created a curriculum for 6 weeks to start, ended up being a year curriculum. And it turned out that it was like the biggest event they'd ever had at the church, bigger than the Obama-McCain debate, bigger than 9/11 ceremonies, the services. It was like a huge thing. There was 15,000 people that showed up and signed up within the first week to be part of the Daniel Plan. And together they lost over 250,000 pounds in the first year. They got rid of all the diseases they had, like depression and diabetes and autoimmune disease. I mean, the list goes on and on. Got off medications, stopped going to the hospital. So, I mean, it was quite a remarkable thing. And then we scaled it up to churches around the world. Actually, we created the Daniel Plan curriculum, which is we have a book. We also have a whole pastor series of sermons for pastors, a whole curriculum for congregants. And we've done this in over 30 churches in Cleveland when I brought it there. And it really inspired me to understand that we really have to deal with the social networks that are driving disease, not just this sort of biological networks. And it's all connected. So I call it sociogenomics.
That's huge. I noticed that in my church. It's like the baked goods, and the way that they communicate their love for one another is often through food and through feeding each other, and not always feeding each other the best things. And I'm watching the community of the church, the health overall being impacted. I live in a tiny little town out here in wine country in Oregon, and a little tiny Christian church, and mostly older folks. And I just want to go back there and like throw all the cookies away and give them a little talking to in a helpful way, because I'm like, you guys, your body's your temple. We got to take care of it.
We got rid of the ice cream socials. We got rid of the pancake breakfast. There were rib breakfasts for guys. You got to come to church. We changed was in the commissaries. We got people doing exercise together, jogging for Jesus. They had gardens they started. So it was like a whole thing that took over culturally in the church, and it was huge. And I think it's something that I think is a model that can be scaled. And we actually turned that into a program at Cleveland Clinic called the Functioning for Life program, which was basically a group model. It's a 10-week curriculum. And it's the same idea. People do it together in groups. And we found, was amazing, Tina, we found that people had 3 times better health outcomes by validated health metrics in the group for the same diseases, treated by the same doctors as individuals who weren't in the group. So this was functional medicine doctors running the groups or doing one-on-one patients. So even better than so if you compare it to, for example, like probably regular medicine, it's going to even be better, because we studied our functional medicine practice compared to a family practice within Cleveland Clinic, and we did better in all health metrics. So we outperformed traditional medicine, but this even outperformed us in our own clinic in one-on-one visits, which is pretty amazing.
That is amazing. The power of community, it's everything. It's accountability, it's community. It gives people a mirror. They don't
Yep.
feel so alone. It's, I think, group, and I'm seeing that more and more too. Doctors actually treating within a group setting, not even
Yeah.
one-on-one anymore. And it's
Yeah.
becoming more popular virtually. I think it's just really exciting because that's it.
Yeah.
That's the ticket too. You were way ahead of the curve on that, but I think we're
Well,
finally coming around. You're way ahead of the curve often early. We got to wait
I'm so
forever.
ahead. I keep falling over myself. But actually, I remember the studies that I was reading about the diabetes prevention trial, and they found that
Yeah.
it didn't matter who ran the groups. If you were, a layperson, if you were a doctor, if you were a nurse, the outcomes are the same. In fact, one study that got me really, kind of clued into this was a study of mentally handicapped people who were overweight or diabetic. And they essentially gave them a curriculum to do together to support each other to change their behavior. And they didn't give them a lot of instructions. So they gave them sort of simple instructions. They actually had better outcomes than seeing traditional medical doctors in terms of their health outcomes for their problem by just helping each other who are mentally handicapped. And we've seen this all over the world. I mean, this has been done in Peers for Progress in Africa with many countries, showing that, by simply helping people help each other, it works. Community is medicine.